Good evening, everyone. I'm in a much more casual mode this evening. Um, I had a whole thing planned out about what I was going to talk about, but I decided that I was going to talk about a topic that is actually relevant to everyone, not just women's health, but everyone's health. But I see it come up a lot, and I can see where, for particularly women, um, they might just be afraid about it or think they can't be intimidated by maybe male practitioners. But I wanted to talk about it. It's very important. You should always ask questions and be aware of what's going on with your body in terms of if you have an illness or a condition or you're told you need a procedure, anything medical that is related to your health, you should understand it completely. Don't let a doctor just say, oh, you have this condition, you need this to be done, or you need to take this pill. Ask about it. What is this? Ask your doctor what it is. Make sure that you understand completely what it is you say that they say you have. Know it like the back of your hand. If they say that you need something done, you need a procedure, you need to take this pill, say, okay, you say I need this procedure. What does it involve? What does this procedure mean? Learn every single thing about it. You need to understand that. You need to be able to relay that to other people. If you're getting some kind of a surgery done where you need physical therapy, you need to be able to tell your therapist exactly what happened to you and what pills you're on and know what they're doing to your body. Don't be afraid to ask questions to your doctor. Don't be afraid to ask, is there an alternative to this? Are you sure this is the absolute only thing that can help me with this issue? Or are there other things that could help me? A lot of times, unfortunately, certain doctors, not all, certain doctors might push medical procedures because if they do the surgery, they're going to get money for doing that procedure. So they may push that. It doesn't necessarily mean that you need it. So it's always important to ask questions. I see a lot of times where people get procedures or they do things and then later they regret it because they didn't ask enough questions about, is this the only thing that can help me? So as the patient, you have the right to know these things. I just felt this was really important, especially also with women's health. Something that I've seen a lot where women who are pregnant get talked into things that happen when they're in the labor room, and they don't think to ask. And what's horrible about this is they don't learn enough about all the things that could happen in that, all the interventions that could come up during the whole process. And when you're in the middle of that, it's very strenuous. You don't think, you may not think about all of the questions to ask about something in the middle of that. You may not think of, oh, do I really need you to give me this drug? Do I really need you to give me an episiotomy or not? And especially if you don't have anyone to advocate for you, it can be really hard in between contractions to think to ask questions about this stuff. So have an advocate for you. Have a partner with you, have a doula with you, have someone with you to help you advocate and ask these questions, because you are still a patient and you have the right to things. You can say no. You do not have to agree to anything. when I was having a child, they asked me if I wanted an epidural, and I said no. And they thought I was crazy, but I said no, I don't want one. You have the right to say no. You do not have to do things. And you have the right to ask questions about anything that happens to you. And you do have rights as a patient. That's a whole separate other thing, but you do have patient rights. If you don't know what they are, you can look them up. They are listed all online, multiple places. But you should be aware of what your rights as a patient are. All right. I've just seen too many times, especially as a massage therapist, people come in and they say, "Oh, doctor said that this happened to me." I said, "Well, what exactly?" They don't even know how to tell me. They said, "Oh, they said there was a problem with this," and it's not even a specific place. I'm like, okay, you have a problem with this part of your body. Did they say what? And they can't even tell me what the doctor told me, so it's harder for me to even address what's going on. But they didn't know how to tell anybody what was going on. I have to figure it out for myself. It just makes me sad. You should always understand everything that's going on with your body. It's so important. So important. You should be the world's best encyclopedia of you. You should always know exactly what's going on with you. So that's what I'm going to say. That you should be 100% aware of what's with your body and advocate for yourself. All right, well, that's what I'm going to talk about today. Next week, I'll do what I was going to talk about. I'll go back to, unless somebody has a question, I'm going to talk about actually how to track your menstrual cycle and how to do that, because I talked about that before. That's important to do. So I'll talk about, hey, maybe you don't know how to do that. That's okay. I'll go through all the steps about how to track the cycle. So you can do that. I hope you all are doing well. Please subscribe. Please like the videos. Please share the videos. Please comment. Ask questions so that we can talk about it. It can be anything in women's health. Stay happy, stay healthy. I will see you next week.